Hi viewers, so today we are back with Medichitchat season 2. It's been a long time, but still, today we have our own pediatrician, Dr. Pallavi Gehlot, and we are here to discuss a very special topic of Mpox. A lot of things are being heard, but if you could guide our viewers, कि what is this? And I'm sorry, हमें हिंदी और इंग्लिश दोनों में चाहिए था थोड़ा सा.
So, hi viewers, we are here to discuss or talk about rather Mpox or monkeypox as it was called initially. ये एक viral illness है which has suddenly come back in vogue after a very long period of time. So, I'll just briefly tell you what it is and what are the things we need to take care so that we are safe in this epidemic. So, Mpox or monkeypox is a kind of a orthopox virus. ये जो है generally it was found in Africa, in the Congo jungles of Africa, where it is very commonly seen in the small mammals there. And from there, people who are handling these animals either by hunting, using their skin or they eat, unke through it gets infected, it infects humans, and that is how it spreads between humans and mammals and other small animals like, the small mammals. So that is what Mpox is. Symptoms इसके कैसे होते हैं when you come in contact with Mpox virus, which can be either while you are handling those animals or with a person you've come across who has traveled to Africa and come, or who have traveled, because now Mpox has spread almost in 120 countries. Over 1 lakh cases have been diagnosed so far, with a few deaths as well. Luckily, India so far has not seen any positive cases, but because of so much of international traveling, we are nevertheless at risk of it, and we should know how the symptoms look. So, Mpox ke symptoms are very similar to what other viral illnesses like chickenpox and smallpox have. Though smallpox is now eradicated, but so it starts with generalized weakness, body ache, a lot of muscle pain, sore throat, swollen lymph nodes, fever which is high grade, and then there are these rashes, typical rashes of Mpox, which starts as small red bumps. Then it gets filled with fluid, and after some time, say 3 to 4 weeks, it bursts, that fluid comes out and it leaves a permanent scar. This whole process takes anywhere between 2 to 4 weeks, and by the end of 4 weeks, it starts recovering on its own. But there are special cases like small children, pregnant ladies, older people, senior citizens, or immunocompromised patients, where this rash or this ailment can be really fatal. So this is the category, or this is the group of age which has to be very, very cautious, to be taking care not to come in contact with anybody who is suffering a rash like the one I mentioned, or these vague symptoms. One person may not have all of these symptoms, but it can, this is the general picture that I'm telling you. It could be something else also, even syphilis presents like that, chickenpox presents like that. So any of these symptoms come to you, you have to take the routine precautions. And what are those precautions? Strict hand washing, using of mask. If you're handling animals, they have to be very careful, to use gloves, to use face masks, to use PPE if possible. And whenever you know that there is a person who's suffering from such symptoms, that person has to be isolated. See, the incubation period, or the time that it takes for before the signs and symptoms start presenting, can be anything between 3 days to 2 weeks. So when the patient presents to you, or when you come in contact with a person who has that illness, he may not be symptomatic. The rashes may not be there. So anybody with even just body ache or fever, pain, you should try and be a little more cautious when we are around that person. Now, how do we diagnose? There is a viral DNA test which is available, PCR, or the polymerase chain reaction test, which we do on either the fluid from the lesion or through the blood that we can do to diagnose this case. And the treatment remains per se symptomatic. If there is fever, we have to take care that the fever is taken care of. For body ache, for general weakness, we have to give symptomatic conservative treatment. Isolation is very, very important. Hydration and rest is very important. There is an antiviral which is being given, but that has not been proven in literature, or research does not show too much of value. But nevertheless, just to make the list complete, there is an antiviral available which is being given. Prevention is more of it a personal thing that we have to do, as we did in COVID. But there is also a vaccine. Mpox vaccine per se has not come, but the smallpox vaccine which was given earlier is also proven to prevent Mpox. So that is one preventive measure that we all need to take care.
One question, I'm sorry to
No
disturb,
problem.
but एक
Yes.
question. As you said कि इसके जो differential diagnosis हैं, they could be like chicken pox also.
Right.
So अगर कोई and chicken pox तो इंडिया में बहुत common है,
Right.
तो अगर बच्चे को किसी को ऐसे eruptions आ रहे हैं,
जी.
तो क्या कोई differentiating factor रहता है कि ये mpox तो नहीं हो सकता?
हाँ, so that is what we have to do a PCR test to rule out from the fluid or from the blood sample.
मतलब
We will
देख के बताना
कहना बहुत
बहुत मुश्किल.
मुश्किल है because they all belong to the same orthopox virus strain.
Okay.
So these are all very similar. All these viral exanthems on an average have similar symptoms. They have similar picture when it comes to that. And then only when we diagnose with the fluid or with the blood, we get to know कि actually कौन सा strain है. So देख के कह पाना मुश्किल है. But as the disease progresses, Mpox का rash is much more severe.
Okay.
And in small children, all in immunocompromised stage, it can have various complications. It can cause encephalitis, which is swelling which you see in the brain, or it can cause a bad pneumonia. Sometimes it can cause vision loss because वो corneal infection कर देता है. So these are the severe symptoms which is not seen in routine patients, but these are the reason why we have a few fatality. There have been over 200 deaths which are seen, and this is the reason where the patient is immunocompromised and can get into
So
complications.
basically इसका जो spread है या जो contamination है
जी.
वो हाथ से छूने पे
हाँ,
ही
so
है.
either it is when you are exposed to an animal or a human who is already suffering or is containing the virus. It can be transmitted through fecal-oral route.
Okay.
So कोई भी body fluid, handling, touching, sex, all of these are wherever your body fluids are transmitted, that is the reason it can get spread. Fomite से generally कम होता है, but nevertheless होता है. इसलिए isolation is always better.
Okay. Thank you so much. And with a new topic, we'll again disturb you, Dr.
Very
Pallavi.
soon, very soon.
Thank
Bye
you so
bye.
much.
My
Thanks a lot.
pleasure.
It was a pleasure meeting you
Bye.
again.
Same here.